people of the Toledo District are scattered in 52 rural villages throughout the rugged countryside. While the bus system does service these villages, some of the residents are unable to use the buses because they are homebound or simply cannot afford the $1 bus fare to get to the clinic. The Hillside Clinic recognizes these roadblocks to health care that the citizens of Toledo District face and uses mobile clinics as a means of providing primary care to these people. Every Tuesday and Thursday, the staff at the clinic loads up their truck with medical supplies and travels to one of the health posts established by the Ministry of Health. The Ministry of Health is the U.S. equivalent of the Department of Health. The health posts are strategically located in larger villages in the countryside, and these posts may service some of the smaller surrounding villages. The health post that the clinic visits each week rotates on a schedule so that the mobiles visit each village once every 6 weeks. This week, we traveled to the Mayan village of Criquehute, about an hour-and-a-half drive down dirt roads from PG. As we pull into the village, the driver blows his horn to alert the villages that the clinic has arrived. The pharmacy is set up in the health post with the supplies brought from the clinic. Again, the villagers begin to line up and wait to see the doctor. The processing of the patients at the mobile site functions in the same manner as it does at the clinic. This is Orland. He is responsible for the patient intake.
I have worked for the clinic 3 years and about 4 months now. Well, the information I get, I take their vital signs and their name, age. Common complaints are like cold and cough, fever, scabies, mainly. Today we have 12 patients in the clinic today.
The patients are next seen by one of the medical students. Each student assesses the patient in a different area of the room and then presents her findings to Dr. Fitzgerald. The health post in Criquehute is quite large, but affords little privacy. Here, Dr. Fitzgerald and medical student Siobhan use a utility closet as a makeshift doctor's office to provide some privacy to their patient. This woman has arrived complaining of chest pain on exertion, as well as joint and muscle pain. She has been having trouble carrying her buckets of water from the river to her house. Getting accurate information from this woman is especially challenging. This woman speaks one of the Mayan dialects, Quechua, and must communicate through a translator. Siobhan presents her findings to Dr. Fitzgerald. Dr. Fitzgerald listens and tries to hear a heart murmur. He asks the woman to walk around the clinic in order to get her heart rate up so detecting the murmur may be easier. Dr. Dave and Siobhan believe this woman has right-sided heart failure. However, with the primitive equipment available at the health post, a definitive diagnosis cannot be made. A medication regimen is decided upon, and Siobhan prepares the medications for the woman. In this setting, the students must operate as a pharmacist as well as doctors. The woman is given enough medications to last her until the clinic returns in 6 weeks. Here Siobhan explains the treatment of drugs to the patient through the interpreter. Educating the patient about their medication regimen is a priority to the staff at the mobile. The students must make sure they are understood before the patient leaves. Most of these people do not have phones and will not have access to another healthcare provider for 6 weeks should they have any other questions. After seeing only 13 patients, the staff and volunteers load up their truck and head back to PG.
We've spent hours and hours on mobile clinics where we drive 3 or 4 hours round trip and see 20 patients, often with just colds and scabies and minor wounds, and we sometimes feel we're not having an impact on the overall health, but just by providing that care, even though it's infrequent and not always to the American standard, you are doing a great service. Even if you treat a child with impetigo or a skin infection, that child wouldn't have been treated, would have been progressively ill, and could have had serious complications from those. So even though what we see, we're treating simple illnesses, I think we're really preventing a lot of more serious illnesses.